Coronary Angiography. Angiography is an imaging test that uses X-rays to view your body's blood vessels. The X-rays provided by an angiography are called angiograms. A coronary angiogram is an X-ray of the arteries in the heart. This shows the extent and severity of blockage in the arteries, which are vital for functioning of heart. With this information, your doctor would suggest the treatment options. These may include angioplasty, bypass graft surgery, or medications. Coronary angioplasty. Coronary angioplasty is the procedure to open the blocked coronary arteries. You will lie on a table in a special room. You will remain awake throughout the procedure. The doctor will use a small needle to inject anesthesia in the upper leg or in the hand. This makes you numb but doesn't make you sleep. This needle prick could be the only pain you will feel throughout the procedure. The femoral artery in the upper leg near where your leg bends from the hip is one of the blood vessels doctors commonly use to insert the catheter and thread it through the artery to the heart to perform angioplasty. Instead of the femoral artery, your doctor may choose to insert the catheter in the radial artery in the wrist. From this access point in your leg or hand, a catheter is threaded through the arteries to your heart. Since there are no nerves in your arteries, you will not feel the catheter. An X-ray camera is used to project images of your arteries onto a television screen, and these images help the doctor guide the catheter to the blockage in the artery. A tiny thin wire is then passed across the narrowed segment. It serves as a support for positioning the tiny balloon across the blockage. Next, a long, thin, flexible tube with a small uninflated balloon at its tip is threaded through the guiding catheter over the guide wire and into the artery to where the artery is blocked. Once in position, the balloon is inflated several times. As the balloon inflates, it flattens the plaque against the wall of the artery. As the balloon inflates, plaque that extends into the wall of the artery may tear or crack. This is normal and necessary. After the blocked or narrowed vessel is reopened, the balloon catheter is withdrawn from the blood vessel. Now, to avoid this blood vessel blocking again, doctor needs to put a stent. Doctor will insert a stent and will expand it fully to hold the blood vessel open permanently. Once it is determined that blood vessel is open sufficiently, all the devices will be removed from the wrist. Number of stents will be decided by doctor as per number of blockages in blood vessels of heart. At the end of the procedure, the care team will work to close the puncture site where the catheter was inserted. This procedure lasts for 30 minutes to 1 hour. As the procedure doesn't involve making major incisions in the body, it's usually carried out safely in most people, and in most of the cases, you will be discharged within 2 to 3 days. If you had planned non-emergency coronary angioplasty, you should be able to return to work after a week. However, if you had an emergency angioplasty following a heart attack, it may be few weeks or months before you recover fully and able to return to work. It's very important to follow medication instructions as suggested by the doctor. If you stop the medication early, it greatly increases your risk of getting a heart attack again. Trust your cardiologists. They are the best to take care of your heart.